Our next speaker is David Momrow from the American Cancer Society.
Good afternoon. I'm Dave Momrow from the American Cancer Society. I have with me Ms. Benetta Sarro, who's a volunteer with our organization. Commissioner Daines, Superintendent Dinello, distinguished members of the panel, thank you very much for this opportunity, and we appreciate your perseverance. In 1990, the American Cancer Society's National Board of Directors set forth goals to reduce cancer incidence by 25% and cancer mortality by 50% by the year 2015. We're more than halfway toward that end point. Unfortunately, despite great advances in research, screening, and treatment, we are not on track to meet these goals. In fact, we will not meet them unless everyone with the potential for a cancer diagnosis has access to appropriate clinical preventive services, including recommended screening services, and every cancer patient can obtain affordable and high-quality treatment, including necessary prescription medications. Significant evidence points to the fact that chronic diseases represent the leading cause of death in this country, and that they are responsible for roughly 75% of our nation's healthcare expenditures. By preventing and effectively managing chronic diseases, we could reduce both mortality and cost associated with our healthcare system. Yet recent studies have shown, for example, that uninsured breast cancer patients have their disease diagnosed at later stages than those with health insurance. Disparities in screening rates for colon cancer, which claims 4,000 lives each year in New York, are even more dramatic, with only 20% of the uninsured benefiting from life-saving care. It is simply unacceptable that less than 50% of colon cancers are diagnosed at early stage in New York State. And the inescapable fact is that insurance status stands as the single largest barrier between New Yorkers and cancer screening, more than age, race, income, and education. The magnitude and effects of lack of insurance in our country are well documented. The clinical literature overwhelmingly shows that uninsured people, children as well as adults, suffer worse health and die sooner than those with insurance. For cancer, this is a critical moment in the fight against this disease. The American Cancer Society has therefore concluded if we are to see an end to the suffering and death from cancer, then New York must ensure universal access to health care. In a background document the American Cancer Society submitted to this panel electronically, we've outlined our 4 tenets of health insurance access: affordability, accessibility, adequacy, and administrative simplicity. We're prepared to hold up this framework against any healthcare proposal to assess its quality for cancer prevention, screening, treatment, and long-term survivorship needs. With me today is Benetta Sarro, a volunteer for the American Cancer Society and a caregiver to one of the 86,000 New Yorkers diagnosed with cancer last year. Patrick Sarro died from lung cancer last October, and Benetta is here to share her story about being denied access to recommended medical treatments and the impact that this has had on her and her family.
Good afternoon. My name is Mrs. Patrick Sarro. Most people call me Bunny. On October 26, 2006, my world stopped at 3:40 a.m. when I held my dying husband in my arms. He had non-small cell lung cancer, from which he passed away that night. He was a husband, a father, a son, a brother, a grandfather. We had 22 years together and 12 children between us. In the end, it came down to medications that he could not have. They were out there, and we just didn't have the money to buy them. This is our story, a story of love, commitment, and faith. It is also a story of a healthcare system that failed us. He was a truck driver and I was a waitress. We are simple people who worked hard and paid our bills and taught our children to do the same. He used to say, If you have everything you need and a couple of the things you want, you will be fine. But never give up your dreams, and you will be a successful person. He called me his lady, and I called him my king. When Pat was diagnosed with lung cancer, he was on Medicare. He had been injured on a job 16 years before, and we had been living on a combination of workman's comp, Social Security, and my income for years. When Pat became ill, we were hard-pressed financially. He was at the doctor's 3 or 4 times a week. In some weeks, we were there every day. We paid $20 in co-pays for each visit. His radiation was a $50 copay. Each of his 14 medications cost $5 a month. The Medicare premium was affordable, but because he was always at the doctor, our expenses kept adding up. We sometimes paid hundreds of dollars a month just in co-pays. Partly because of Pat's expensive illness, I could not afford insurance for myself. I was a waitress and my employer did not offer benefits. I lost my health insurance when Pat lost his job after the accident. And when Pat became ill, I was forced to leave my job because Pat needed me, and that was more important. I didn't see the doctor much because it was Pat who really needed the doctors. In the end, as I said, it came down to the meds that he could not have. His doctor prescribed a targeted cancer therapy called Tarceva, but Pat had hit the donut hole in the Medicare plan. Remember, he was 59 and disabled, so we were not eligible for EPIC. We could not afford $710 per prescription, so he did not get the drugs that his doctor thought would help him survive. Instead, we accepted the services of hospice and he was sent home. Over the next 3 days, we had over 300 people come to our house to say goodbye. We were so rich in family and friends. At his funeral, there were over 550 people, from city officials to firefighters to street people, who knew him and loved him and respected him. Today, I am still uninsured. I received some cancer screenings through the Healthy Women's Partnership at Glens Falls Hospital. I do receive a part of Pat's Social Security, but I have other health problems, some of which prevent me from working like I used to. I can't afford to see the doctor. I can't afford to purchase health insurance plan. My monthly income is just enough that I do not qualify for any public insurance programs in New York State. My one hope now is that I do not encounter any major problems before I am eligible for Medicare in 1 year. I don't know if Pat's meds would have bought him more time, but I do think we should have been given the chance to find out. And I do know that 12 children, 23 grandchildren, and 9 great-grandchildren will never share their hopes and dreams and problems with him again. He was Papa to everybody. We are just one family. How many more like us are out there? How many more may have suffered because they could not afford it? I don't know, but I hope and pray that my story will help you make good decisions so that no one else has to suffer like we do. I wear this pin of my husband Patrick to honor him, and in the hopes that we can all stand here together someday to celebrate the lives saved, not lost. Thank you, and God bless you all.
Thank you very much. Appreciate it.